sitting after walking with the axillary crutches for an individual with right knee arthroscopy. And so once again, it kind of depends on the condition of the individual and where they might be at. The way I was looking at it was being non-weight bearing afterwards, and also kind of a straight leg still with it, assuming that it was like right after they had their procedure done with it. So starting off with sitting now, they still had the straight leg. The idea that you want is you want both of the crutches on the same side. You want to reach through and kind of have your hand like that, and then put your other hand down on the mat in order to push off. Once again, a big mistake that we see with it was similar to what Luke was saying. You don't push off like that. That's not the way that you want to do it. So you pair them together, and then push. Once you have your center of balance, you transfer the one over, and then you can proceed to move from there. Returning back then, similar way really with it. I personally find that it's just kind of easier to back up towards it, or if you were to go from the side that's good side kind of type of thing, and then you transfer over, put the hands underneath it with it, put your weight through the good leg, as well as then balancing with the crutches together in the left hand, in this case. Feel the bottom, and then sit down.
Very good. Any questions? Okay, thank you.
3.8 with standard walker with weight bearing as tolerated. So they can put some weight on their affected leg, but with 3-point gait, you want to have the affected leg and the walker move forward at the same time, and then follow through with your other foot. Because it's total knee replacement, they want to keep that knee straight as well.
You want to just demonstrate a few more steps for them, so they're sure.
You want to have all 4 points of the walker landing out at the same time, so you have the little base of support.
Any questions for? Okay, very good.
Has painful right knee and left ankle, so I'm doing 4-point gait with the axillary crutches to distribute the weight evenly. So to do this, you would have them start by moving one crutch, and then you're gonna bring your opposite foot forward, move the other crutch, and then bring your opposite foot forward there, and then just continue to manipulate.
Okay, any questions? Everybody see that? Okay, good, thank you.
Tibial fracture with a walking cast, and they're 50% partial weight bearing with the crutches, and so you obviously fix your crutches to the patient, and then you're going to use the 3-point gait, but because they're only partial weight bearing, you have to calculate essentially how much weight they can put on the affected leg. So what you would do is, ideally you would have a scale in your clinic, especially if it's an outpatient clinic, and you can either ask them like how much they weigh, or you could just have them step on the scale, which is probably more accurate. And then you're going to take 50% of their weight, and you'll have them walk up to the scale, and with their affected leg, they will put pressure increasingly onto the scale and watch it go up to whatever number you've calculated as 50% of their weight. And you want them to also like step on the scale using their crutches so that they get a feel for truly how much weight they have to put through their crutches and how much weight goes on their foot. And then you can have them ambulate with the 3-point gait. So your crutches will come forward along with the affected side at 50% partial weight bearing, and then the good leg will come through.
A few more steps. Did you see that? Yeah,
I'm supposed to be fitting into a 9-year-old child with spina bifida. That's what it said, wasn't it?
Yeah.
Spina bifida with left, whatever. Yeah, 9-year-old. Yeah. Okay. She's the closest I could get. So to start off with, we'll start with the hand placement of the handles. It says in the book to either go from the greater stroke canter, the wrist crease, or the ulnar styloid process. So as they're standing, full standing position, just where the wrist crease is, that's where it should be. And if you just stand for me. Ty, I need to use yours. These are going to be way too short. Good technique. Awesome. Okay, so a little too tight. All right, there, right about the wrist crease. Can you hang on to that one, please? It's the wrong side. Okay, next thing we want to address is the cuff. First of all, these cuffs are going to be a little too loose for her because, as you can see, she can pretty easily slide her hands out of them. You're supposed to be able to adjust them, but I think with these, you're just going to have to go grab a smaller cuff and replace it, or grab smaller crutches. So where the cuff should be placed is about 1 inch to 1.5 inches away from the olecranon process. So can you actually roll your step and then put your hand here and grab the handle? So this is a little too high because her olecranon is actually in there. So I'll shorten that up. So her olecranon's right here, about 1.5 inches downward. And then to make sure it's at the right height, what you want to do is put the pad on the ground 2 inches out and 6 inches in front of the feet. Can you do that for me? And then in a normal standing position, her elbow should be flexed at about 20 to 30 degrees. And it looks like it's about 15 to 20, so I'm going to call that good.
Your place and also have you sit down. Might want a chair. Might want a chair.
I just pull up the.
Actually, this will work.
Oh, just
so
okay.
Yeah. Cool. And with the walker. Roll that walker.
Get out of the way. Probably pause this part of this.
I want to make 2 separate videos.
Alright, so the first thing we'll do since we're standing is show you how to sit down. So with a right total knee replacement, depending on what your doctor says, you might have no weight bearing, partial weight bearing, but either way you want to keep your right knee out in front of you during the sitting process. So first thing is you're going to back up to the seated surface so you feel it in the back of your knee. Once you get right there, you're going to reach back while keeping your bad leg or your involved leg out in front of you. Reach back until you can feel the surface and then slowly lower yourself down. Again, while keeping the majority of the weight on your good leg, not the involved leg. And then to get up, you would scoot to the edge of the surface. Get your good leg underneath you, your involved leg out in front of you. Be sure to keep it relatively straight, again, depending on your doctor's recommendations. Now, one of the mistakes a lot of people make when doing this with a walker is they reach forward and push themselves up. That's a no-no. You want to lean forward, push with both hands right here, push yourself up, get your balance first, and then grab the walker. Again, while keeping your involved leg out in front of you. A different way to do it, or an alternate way that the book proposed, is to put one hand on the seated surface and the one hand on the walker, lean forward and push yourself up this way. Again, establish your balance, and then grab both sides.
Me to practice through it.
Should I have Rob practice it, and I can
Sure.
Analyze.
I'll analyze you yet. I just want you to start with the
Alright.
sitting down process.
Okay.
Okay, so your right knee has been replaced.
Mhm.
Should be able to run in a few weeks, so back up. So you feel it on the back of your leg. You
Okay.
feel it?
Yep.
Alright, now
The
reach,
hands on there.
now reach your hands back to the
Oh.
surface. Slowly lower yourself down. And there you go. Alright, now stand back up. Scoot forward. Keep your involved leg out in front of you. Once you get your good leg under you a little bit more, so you have more surface. There you go. So you're going to push yourself up, get your balance, and then grab the walker. Any questions?
Okay, I have a question.
Yes.
And you can phone a friend if you want. If you were,
Oh, that's
I'm non-weight bearing on my right side, going up and down stairs with no railings. So with this, Austin kind of did it, except I can't put my right leg down. So pushing off the crutches and bringing my left foot up the stairs, then the crutches, pushing off, bringing my strong leg up like that, keeping my non-weight bearing leg off the ground. And then to go down, come to the edge, the crutches go down first, followed by the strong leg, crutches again, strong leg, all the way down.
nailed it.